Welcome! In this explainer, we're diving into one of the most critical roles in all of clinical research, the investigator. We're going to break down exactly what this job entails, all according to the International Standard of Good Clinical Practice, or GCP.
Okay, let's just start with a really crucial concept. It doesn't matter how big the team is, how massive the hospital. GCP is crystal clear that in every single clinical trial, one person is ultimately accountable for everything that happens at their site. The buck really does stop with them.
And yep, you guessed it, that person is the investigator. You can think of them as the essential link in the whole chain. They're responsible for protecting the trial participants, making sure the data is rock solid and credible, and really upholding the scientific and ethical integrity of the entire trial. It is a huge, huge responsibility.
So how do they even manage all of this? Well, it helps to think of an investigator's duties as resting on three fundamental pillars. And the first one, which is by far the most important, is this ethical imperative to protect the rights, the safety, and the well-being of every single person participating in the trial.
So before we get into all the specifics, let's just pause on that for a second. With all the complex tasks an investigator has to juggle, what do you think is their single most important duty? This is the one principle that has to guide every single decision they make.
The answer, of course, is ensuring the medical safety and well-being of the participants. This means all medical decisions related to the trial have to be made by a qualified physician. The investigator has to provide care for any adverse events that pop up, and they should even try to figure out why someone might drop out of a trial early, all while, of course, respecting that participant's rights.
Now, this is so important. Look at how this is framed. Informed consent isn't just about getting a signature on a piece of paper. GCP actually defines it as a discussion. It's a whole process. You inform someone in plain, simple language, you give them tons of time and opportunity to ask questions, and only then do you document their freely given consent. And this is non-negotiable. It has to happen before a single trial procedure begins.
And, this process demands even more care when we're talking about vulnerable populations. For instance, if a participant can't read or write, you need an impartial witness there for the entire discussion, just to confirm that consent was truly informed. For kids, it's about getting consent from the parents, but also getting the child's own agreement, their assent, using forms they can actually understand.
Okay, so once we have established that protecting participants is job number one, we can move to the second pillar, and this one is all about protecting the scientific integrity of the trial itself. I mean, think about it. Participants are volunteering their time for the advancement of good, credible science.
And this all starts with sticking to the trial protocol. I mean, religiously. The protocol is the blueprint for the entire experiment. The only time an investigator should ever deviate from it is to eliminate an immediate danger to a participant. Any other change, it needs a formal amendment and ethics approval, because any unplanned deviation can completely jeopardize the data.
The investigator also has to manage the entire life cycle of the investigational medicinal product, or IMP, at their site. That means tracking it from the second it arrives, making sure it's stored securely under exactly the right conditions, dispensing it correctly, and then accounting for every last bit of it. And of course, every single step has to be documented.
And this slide right here really drives home why that matters so much. This isn't just a paperwork exercise. If that IMP is stored at the wrong temperature, for example, it could become useless, or worse, it could become harmful. A failure here could literally harm participants and make the entire study worthless from a scientific perspective.
Now, the enemy of good science is bias, right? So to prevent that, investigators have to be super strict about following the trial's randomization and blinding procedures. They have to protect that blind, but they also have to be totally prepared to use the emergency unblinding system if a participant's safety is on the line. And if they do, they have to document and report it immediately.
Which brings us perfectly to our third and final pillar, and this one is honestly the bedrock that holds everything else up: comprehensive and accurate documentation.
You've probably heard this saying before, and it is the absolute mantra of GCP. In the world of clinical research, if it wasn't written down, it simply did not happen. The paper trail, the records, that is the only verifiable evidence that the trial was done right, that people were protected, and that the data is credible.
So how do you make sure that data is high quality? Well, there's a handy little acronym for that: ALCOA. Is the data attributable? Can you tell who wrote it and when? Is it legible? Is it contemporaneous, meaning was it recorded in real time? Is it the original record? And of course, is it accurate? This simple acronym is really the gold standard for data integrity. So what happens when you make a mistake? Because, let's be real, it happens. Well, there's a very specific procedure for corrections. You never, ever erase it or use whiteout. You just draw a single line through it so you can still see the original, write the correction nearby, and then you initial and date the change. This way, you have a completely transparent audit trail.
And these principles apply across all the key documents in a trial. You've got your source documents, that's the first place data ever gets recorded. Then there's the case report form, or CRF, where that data is sent to the sponsor. And finally, you have the study site file, which is basically the investigator's master binder with all the essential records for the whole trial.
So you can start to see how these three pillars aren't really separate duties at all, right? They're all interconnected. By protecting the participants, protecting the science, and protecting the record, the investigator fulfills their ultimate responsibility. They're building the very foundation of trust that all credible medical research stands on.
And get this, that responsibility doesn't just end when the trial is over, not by a long shot. Regulations require that these essential records be archived for a minimum of 5 years, and in a lot of cases, it can be much, much longer than that.
So while the investigator is absolutely pivotal, it's pretty clear these responsibilities are just immense, which leads you to wonder, right? How does one person do all of this? And that raises a bigger question. How does the entire research ecosystem, the sponsor, the ethics committees, the regulators, how do they all work together to support the investigator? It's a great reminder that this critical role doesn't exist in a vacuum. It's part of a much larger system of shared accountability.